Hello friends, good evening and welcome back to another session of DogSpot's live interviews with experts. Today we take pride in introducing Dr. Alopa. We take pride in the dog world because she's the only certified physiotherapist in the canine world in India. So a very warm welcome, Dr. Alopa, to our session today. I'd like to tell our viewers a few things about Dr. Alopa. She's done her bachelor in physiotherapy and then her master's in Pune, which is human physiotherapy. She's been practicing that for 7 long years, and canine physiotherapy for about 3.5 to 4 years. And she's the only certified physiotherapist from the world famous school in Melbourne, which is run by Michelle Monk. And she did a certificate course from there. She's been active in a full-fledged physiotherapy and a rehab center in Australia. And she's had vast experience in dealing with cases of hind limb paralysis, of post-operative FHO, TPLO, facial paralysis in dogs. So we are all set for an absolutely wonderful session, because I personally feel in all the years that we've had dogs that physiotherapy has been our weakest link, particularly in cases where we were facing injuries and post-surgical recuperation. So thank you for joining us, Dr. Alopa, and we look forward to a session with you. It's over to you. Tell us something.
Thank you so much.
Tell us something more about this.
Yes, thank you so much, DogSpot, for having me over, and thank you so much, Shharat sir, for hosting me. So as correctly said by Shharat sir, I have done my certification course in Australia, but I would like to make I would like to focus on one point over here, that the treatment modules and the rehabilitation modules that are used in developed countries are much, much different than what we can use over here. Because over there, there is, high-tech modalities are easily available, which are not available in India.
Right.
So more than my practical exposure over there, what really helped me over here was my hands-on practice and my learning experience under Dr. Milind Hatekar, who's a renowned orthopedic surgeon in Pune.
Yes, we've all heard about Dr. Milind Hatekar and his accomplishments in this field, and we hope to have him with us one day live on DogSpot, because there are so many areas we would like to talk to him about. But tell me something. I'll explain to the viewers what our session is going to be today, and we'll start with talking about an introduction to canine physiotherapy. But tell me, what basically is physiotherapy, particularly for canines?
So physiotherapy is basically a scientific approach. A method which is used to alleviate pain, which is used to enhance recovery after any kind of injuries, surgeries, something like age-related disorders and obesity. What physiotherapy usually focuses on is the joint stability, the joint mobility, the muscle strengthening, and how a person or a canine will bear weight in his walking cycle. In physiotherapy, we use different modules. In physiotherapy, we use different modules. Like there is electrotherapy, there is exercise therapy, and of course, there's the much known and well-known hydrotherapy. So all these modules we definitely can apply to canines. I would say that the principles of human physiotherapy and canine physiotherapy are pretty much the same. The way you apply them, the way you think and give them exercises or get exercises done from your pet dogs, is where the actual skill is.
No, what is interesting, Dr. Alopa, it's, we would like to know, because people who have had dogs have heard this term basically being used only for humans, physiotherapy. And why do you feel that it's a therapy? Why is it not a treatment? Because in the medical field, there's always a difference between treatment and therapy. So is it because it's protracted? Is it because it's not because of medicines and it's because of exercises? How do you differentiate between the medical treatment and the therapy?
Therapy is something that will take care of you in a holistic way. We don't use the medicines. We use the exercises to make the dog functionally active. In medicinal or in surgical treatment that we are basically treating a pathology, one condition, where we usually focus on getting the dog back. For example, if a FHO, like the femoral head osteotomy, which is pretty commonly performed in hip dysplasia in dogs, after that, if you do not give physiotherapy exercises, the dog and the lameness is still together. Like the dog is never free of lameness. So we are not just looking at it as, like, being physiotherapists, we are not just looking at it as, okay, this is dysplasia. We are looking at making the dog functionally active, functionally independent, and going back to whatever functional activities he was doing before he had the surgery.
Yeah, that's a wonderful point. So basically, our viewers must understand that the surgery part of it, the pathological treatment part of it, is just one part of the entire recuperation program. Unless you bring the muscle tone, and unless you bring the dog to exercise those muscles, those tendons, you're not going to fully cure the ailment. So we must start looking at the problems of hip dysplasia and other bone injuries and disorders in a more holistic way. Am I right, Doctor?
Right, absolutely right. So it is what we can say is, like, the medical treatment, the surgical treatment, and physiotherapy rehab, they are incomplete without each other. They
Right.
go hand in hand, and and if they are used in a symbiotic method, you can get maximum benefit or maximum result from a dog or from any patient.
Okay. Now, sticking on to this topic of introduction, we know the structure of the dog. We know the four quarters, the bones that are primarily making the four quarters, the bones that are primarily making the hind quarters, the lumbar joints, the thoracic vertebrae, etc. Now, tell me, in your experience with dogs, which part of the anatomy, which bones most commonly are, in need of physiotherapy, whether it's an injury or a post-operative? What are the most common joints and muscles and bones that you treat?
Keeping the joints and muscles and bones a little bit away, the first thing that we need to tackle in physiotherapy is the preventive physiotherapy. So that,
Wonderful.
because right now we are seeing a lot of obesity related problems in dogs, as with the medical advancement, the life expectancy of dogs is increased. As the dog ages, there is a lethargic lifestyle that is set, particularly in a home-based dog where both the parents are working and hardly can give him time. So there are a lot of obesity-related issues. So right from how to prevent obesity, because obesity is one of the major factors which give rise to all these bone and muscle problems.
Absolutely. Are you facing it in any
The
particular
second thing,
breed of dogs?
mostly the Labrador retrievers.
Okay, and this is being commonly
So
practiced by
mostly
you?
the Yeah, because then if we give a set of physiotherapy exercises for a pet parent to carry out, and if the pet parent is carrying it out persistently and religiously, then definitely he or she can avoid their dog being obese, and ultimately avoid the hip or the knee problems that arise because of obesity.
Okay, wonderful. And tell me,
Another joint issue that we are commonly facing is, as our topic is saying, is the hip dysplasia. So most of the pet parents are consulting me for hip dysplasia.
okay. No, I would like to, go back to obesity. Yes, absolutely,
Mhm.
Labrador. Now, when you recommend physiotherapy, we all have now started living in apartments. We are facing
Yes.
constrained space. There are many public places and parks where dogs are not allowed anymore. So, in this environment, what kind of physiotherapy are you now concentrating on so that people are able to, use the limited space to still get the best exercise?
Right. So to begin with, physiotherapy is always a combination of good cardio exercises and good free exercises. Right.
Right.
So initially I would just ask the pet parent to first take out the dog for 30 to 40 minutes of a good walk, probably outside. After coming back, a simple training task that we usually use is, like, asking the dog to sit and get up.
Right.
This actually works on the hind limbs as it works on the hind limbs for human beings in squats. So it is like the modified squats for dogs, where you can just, make your dog sit down and get up, sit down again and get up. You do it 10 to 15 times and the hind limb muscles are fatigued, they're tired.
Right.
There are other few things, like if a dog is not having any underlying pathology, you can just ask the dog to keep his forelimbs on some heightened surface like a couch or a chair and just give a count till 50. Similarly, you can do it vice versa. Ask.
There are a lot of senior people who have already started seeing our pouring in a lot of questions, and we'll come back to your questions. Everybody, just give us a little bit of time for the introduction on the topic, and we'll pick your questions one by one. I had a lady from Pune, from your city, Dr. Alopa, send me some pictures today about her Labrador, which she felt is arthritis. But you can have a look, and then we have a lot more questions which came in yesterday. But coming back to the squat exercises that you mentioned, interestingly, the squat and the manner in which the hind, angles, the hind bones and the hind quarter muscles are used is also an indication of hip dysplasia. So
yes, obviously, yes.
Have you found a correlation between hip dysplasia and obesity, or is hip dysplasia, in your experience, still purely genetic?
As of now, what the research is saying is they are still working on the environmental factors which are contributing to hip dysplasia. Till now, the established research says that hip dysplasia is a genetic malformation of the hip socket. But yes, there is also a second school of thought which says that hip dysplasia might be aggravated or might be set in because of the environmental factors, which include many things like obesity, the lifestyle of the dog, the tiling and the flooring that apartments these days are having. But we cannot say anything for sure because the research is still ongoing.
Right. Okay. Now, I just let me get back to an interesting question here, because we might miss it because it's an interesting question. Dinkar Pratap Singh says, what physiotherapy can be done for fit older dogs who start to have issues with their hind legs? We were talking about hind legs, so I picked this question.
Right.
So here is the question. He says, what physiotherapy can be done for fit older dogs who start to have issues with their hind legs with age, especially in winter and after a good night's sleep, like muscle cramps?
So a very homemade nani ma ka nuskha works for this kind of these kind of dogs. Usually, what happens is in winters, the joints tend to become stiff. The muscles tend to become stiff. This is a very common complaint that at night, when the muscles are relaxed completely and there is no movement, the joints tend to become more stiffer. As soon, if at all, the pet parent experiences or observes lameness only in the first few hours of the morning, then what they can do is, as soon as the dog gets up, they can just give a warm pack on the hip and on the knees, on both the sides. They can just dip a Turkish towel in warm water, wring out the water, and just wrap or keep it on his hindquarters.
Okay.
And that should take care of it.
Well, Dinkar, I hope that helps, because you live in Missouri and it can't get any colder than it does in Missouri. So I hope that, whatever
so that will definitely help him.
Yeah. Okay. I'm taking another question, and that is from my friend Anjali Vaid. She's basically asking for treatment of arthritis. So any comments?
So arthritis is basically an age-related issue. So it is basically when the joint surfaces undergo wear and tear and the muscles become weak. Because the muscles are weak, the dog experiences pain. Unfortunately, he's not able to tell it to you, so he will give a symptom of lameness. So this is basically a vicious circle that a dog goes in. So it's like arthritis, pain, muscle weakness, lameness, again because of that muscle weakness, because the dog tends not to use those muscles which are painful.
Okay.
So we have a very good protocol for arthritic patients. You start with gentle passive movements. When you don't ask the dog, when the dog is lying down, you can do the movements yourself of bending the ankle, bending the knee, and then gently go on to weight bearing and active exercises. So in arthritic cases, I will definitely not recommend a lot of sit-ups. I will definitely not recommend a position where the forelimbs are on a heightened surface and hind limbs are down, because that will increase the weight bearing on the hind limbs and might aggravate the arthritis issue. If there are no other issues with the dog and the dog is perfectly fine otherwise and
Yes.
enjoys water, then definitely once the basic muscle strength has been taken care of, he can start swimming.
Okay, that's wonderful. I've got a compliment for you, Dr. Alopa, from Abrar Ahmed. He says, "I'm so happy to testify of the good work of Dr. Alopa. It's a long, long compliment. I suffer from herpes virus and I have frequent symptoms, and so sometimes it go away." And so he's talking of how you helped him in other physiotherapy, not canine physiotherapy, but it's a compliment all the same.
Yeah. Thank you
Thank you,
so
thank
much.
you, thank you, Abrar. Okay, I've got another one. I'll take this and then we'll go back to the topic because this seems interesting. How to increase hind leg strength of my seven? I mean, I presume he's saying 7-year-old GSD.
7-year-old GSD, right?
Yeah.
So GSD or German Shepherds are, you can say they are bulky breeded dogs. They've got a lot of muscle mass, so you need to exercise them a lot,
Okay.
right? So if he's not having any other pathological conditions, you can start by, staircase climbing, which is a very good exercise for hind limb strengthening. You can start with longer walks or walks on inclined surface. So that will help in hind leg strengthening. And you can also start with what I have mentioned, like, forelimbs on a heightened surface and hind limbs down. So that also is again a very beautiful exercise for strengthening the hind limbs.
I'm so glad you
Swimming
mentioned
also
this.
can be started.
I'm are you there, Dr. Alopa? We seem to have lost her
Yeah,
audio.
yeah.
I'm so glad you
Is it?
mentioned it.
No, I'm good.
No, you're fine. You're doing okay. I said I'm so glad you mentioned about the walking on the incline. When we started keeping German Shepherds many years ago, and at that time there was a lot of weakness in the hocks and the hindquarters of the German Shepherds. This is what our gurus used to tell us: walk up the incline for the German Shepherd to give it strength. So things have not lost their relevance even after 40 years.
No, definitely not.
It's good to know. Yeah, okay. There's this interesting topic you wanted to discuss, Dr. Alopa, which was, physiotherapy in working dogs versus pet dogs.
Yes.
Our
So,
pet parents are from both worlds, primarily from
right.
the pet world, but also who have, obedience dogs and working dogs. So I would not stop you from, sort of a talk on this on your own. Please tell us something about this.
So basically, when we are just making a protocol, a physiotherapy protocol for any dog, the phase one, especially after post injury or post surgery, the phase one pretty much stays the same for a pet dog or a homebound dog and a working dog. However,
Right.
the phase two and phase three, where we focus more on strengthening the muscles, working out on the endurance of the muscles, that is the time when the differences actually occur. A working dog, for example, if we take an example of a military dog or a police dog. So if I rehabilitate him or her as per my home dog, they are going
Right.
to be a big failure in their career. So they have to be treated, they have to be rehabilitated in a different way, thinking and taking into account what all activities they are expected to perform.
Okay.
So in that case, for example, in a working dog or a military dog, what I would be focusing more on is like, the muscles which will carry him or which will take him swiftly from one place to other so that he can perform his work much faster.
Okay. Okay.
The BSF dogs, the Border Security Force dogs, which are there, they
Yeah.
have a lot of, not only just they have to work on their, we have to also work on their sniffing muscles. We have to work on their facial muscles so that their sniffing power increases. So it's like
Absolutely.
a whole different field. It's like a whole different field when we are taking care of a pet dog and when we are taking care of a working dog.
So that's interesting. So if I now juxtapose what you just said with the introductory remark, we are basically looking at canine physiotherapy not just as something which is post-operative healing, not just to bring the whole muscle structure back, but it can also be designed for specific purposes to which the dog is put. Am I right to say?
Right. It differs. It differs from. It is not even same. The physiotherapy protocol is not even same in two Labradors who are staying at home, because
Absolutely.
both those Labradors are having completely different lifestyle. Even though they are Labradors of the same age, they are belonging to the same breed, and they are home-based dog. Still,
Right.
whatever activities they are doing, they are different. One might stay in a bungalow; he has to do up and down. The other one might be staying in an apartment. So the physiotherapy and the exercises will completely differ.
Okay, so basically, it's a tailor-made, custom-made protocol that you have to design every time you come across a patient. You see his body
Right.
weight, you see his lifestyle, you see his living conditions, and then you come up with a protocol. And
Absolutely.
what is normally the duration of a physiotherapy protocol for, let's say, a Labrador recovering from hip dysplasia?
So if it is a post-op, we usually give a time span of around 12 weeks for him to be completely fine. So for 12 weeks, that is approximately 3 months, the pet parents have to be patient. They have to be consistent in getting the exercises done from their dogs. They have to do them religiously, and then they will be seeing the result.
Okay. Now, because you mentioned facial muscles, there's a question related to it. I'm pulling it in just now. This is a question
Mhm.
which says, can you give some examples of the exercises you do for increasing the sniffing muscles of working dogs?
So you can just expose them to different kinds of aromas, different kinds of smells. The smelling power of a dog is extremely high. You can start by giving a normal, say for example, you're giving a bone to smell, a bone to smell. You can just first show it on the hand where he sees also and he sniffs also. Then
Okay.
once that is done, you close it and he has to sniff out. Once that is done, you hide it and then he has to sniff out. Now, a bone is something with a very strong smell. Once
Right.
that is done, when we can easily find out where the hidden bone is, we go on to milder fragrances for him to
Right.
find it out. So that is
Oh,
how we work out.
okay. Saili, I hope that answers your question. It's very interesting that she suggested these three different ways of doing a sniffing exercise with the bone. Thank you for that, Dr. Alopa. Okay.
Thank you.
This is another interesting question I'm pulling in. It says, hello, Dr. Alopa. This gentleman is from Chennai. And he says we have been normally given, times in the early morning or evening for walking our dogs because of the Chennai climate. Does the same time
Mhm.
apply for physiotherapy or can it be done at other times?
So if we are getting the exercises done in phase one, you can do it at any time of the day because they are usually the basic exercises which are not going to cause a rapid heart rate, or they're not going to increase the respiratory rate. But it is definitely recommended that if you're staying in a place like Chennai where the climate is humid and hot, then it is better that you even do the physiotherapy exercises early in the morning and late in the evening. Or if you have an access to air condition, get them done in the air conditioned room any time of the day.
Okay, now I have a question of my own here when we are talking of physiotherapy and working dogs versus pet dogs. You would have had exposure to a large number of working dogs and agility trial dogs while you were in the center in Australia. Now, did
Mhm.
you find any cases of physiotherapy being needed in dogs that are used for hunting, in dogs that are used for retrieving, in dogs that are used for normal, agility trials? Was their requirement of physiotherapy different from pet dogs?
No, actually, where I had gone over there, we had all the OPD based exposure. So it was we did not go into those working dog exposure where, and we did not see the patients who were coming for physiotherapy over here. But I have read about it, so there is no practical exposure as such with the working dogs. But yes, whatever I've read about it, it definitely says that these are the protocols different for different types of working dogs.
Okay, but here in India, have there been incidents of the police or the paramilitary forces approaching you for physiotherapy?
No, I have just sort of rehabilitated one puppy who was supposed to go for his police training.
Okay,
So yeah, so he had some issues with limb and the lameness in his hind limbs.
okay,
So before actually admitting him for the police training, they had consulted me, and I had shown them a few exercises that they can take, and so even the police force was taking care of those exercises later on as well.
okay. Well, I hope that our live session is being heard by all our friends in the paramilitary forces and defense forces, and they use this
Yeah.
forum now because this is a field, as I said, which is totally novel and new in India, and it's something that we desperately needed. I have had,
It's very unexplored as of now in India.
it's totally unexplored. As a matter of fact, I'll tell you,
And
I'll bring to the notice of the viewers. I normally have 2 or 3 handbooks on medicines and for instant cure if you need it, because we have so many dogs to look after. And so when I was preparing for your session, I had this. This is a book I have, which I have used for, I don't know, 20 years now, or maybe even more. And you'll be, it's interesting, Dr. Alopa, that this edition of book, which I bought sometime in 1991 or 92 from Bangalore, the entire book covers all diseases, but makes no mention of physiotherapy. I checked the entire musculoskeletal system. I checked the injuries. I checked the, cases of hip dysplasia, cases of wandering lameness, of hopping hawk. And it's surprising that even 25 years ago, this is a US published book, there is absolutely no mention of physiotherapy.
no.
It is
That's
that
because
long.
in humans itself, physiotherapy started, gaining acceptance after World War II. So if
Correct.
you look at it, even the human physiotherapy is not that age old.
Right.
So
All the
obviously the
more,
canine physiotherapy.
all the more reason, if we have someone like you, we should grab with both the hands this opportunity and use it for the betterment of our pets, of our dogs. Because I
Oh,
was once,
I'm very grateful and thankful because in Pune, I have had, I have met quite a few veterinary surgeons who are very much open and accepting the good benefits that we are getting out of physiotherapy. The primarily one being Dr. Milind Hatikar, because,
yeah.
and then I have also traveled to other cities apart from Pune where I have met veterinary surgeons who give me a call and tell me that please come down to Bangalore. We have 2 3 patients who would need physiotherapy, and
Let me
then I fly down to Bangalore. So
Let me pull in this comment by Mr. A.K. Mittal. He says medicine and physio are competitors.
I don't think so. I think we work hand in hand. I think we work
I would,
symbiotically. But
I
I would say that a physio is incomplete without a medicinal doctor, and a medicinal doctor is incomplete without a physio.
correct. Okay, so I'm now going to. Uh, okay, this is a compliment again, and physiotherapy is highly underrated even in humans, says Saili, which is quite true because, as you just said, it's a relatively new science. And
Yes.
okay, now tell me, I was, Dr. Lopa, I'll take a little this thing liberty. I was reading up today, and I have this lovely book on the structure and terminology, which we keep reading. Now it says that there are five dogs have 5 general types of attachments that allow movement. There are
Mm-hmm.
5 general types of attachments that allow movement. A sliding joint, like the shoulder blade, a ball and socket joint, like the hip joint, a hinge joint, like the elbow, a rotatory movement, and movements without bones, as in the tongue. Now, if these are the 5 primary joints that normally are associated in our canine terminology, which parts, I'm again repeating, which parts are the ones that are most frequently put to, treatment under physiotherapy?
I would say that a ball and socket joint and a hinge joint are, cases are coming up more of ball and socket and hinge joint. So definitely we are having good results and physiotherapy is given for them. We also have to consider that these are the large joints, like the elbow joint, the knee joint, the hip and the shoulder are the large joints. And
Right.
so giving physiotherapy or giving exercises to these joints is much simpler than giving physio to small joints. So definitely physiotherapy is needed and physiotherapy is asked for usually for ball and socket and hinge joints.
Right. Okay. So let me now, move on to another topic which we wanted to discuss. If you have something more to say about the different treatment between working dogs and pet dogs, we can take that first, Dr. Loh. Or if you are ready, we can move on.
I think
Whichever way.
pretty much covered about it. Yeah, because working dogs is a vast issue. We have to go by each type of working dog, like a herding dog, a military dog, a police dog. So
Say
it's a
something.
big topic in itself.
Say a few lines. People would be interested. German Shepherds and herding dogs has a vast following in India. Say something to us
German
about,
Shepherd, sorry, I did not get you.
yeah, hip dysplasia, pasterns, overloaded shoulders, weak hock joints. How are you using physiotherapy? German
Mhm.
Shepherds.
In German Shepherds, as in herding dogs, you're asking for working
Yes,
dogs?
yes, herding dogs.
Yeah, okay, all right. All right. So for herding animals, what we usually do is they don't have to run a lot. Or what they need to do is they need to work out on their stamina because it is a low intensity prolonged activity that as we classify it. So we have to work on so we have to work on the muscles which are more contributory to the endurance and the stamina of the dogs.
Right,
So first and foremost, the herding dogs or whoever are having herding dogs should make a point that they are not overweight, which they usually aren't because they are into a prolonged activity. But
right,
there are chances that if the diet goes wrong, if the dog is not used for a long period of time, then they end up in obesity, which indirectly cause overload on the heart if they are suddenly made to walk for a long time in herding
right,
activities. So
right.
it is always better to, in a herding dog, it is always better to work out on his endurance, which is a low intensity, prolonged time activity, rather than working on his general strength and his quickness and his agility.
Okay. I'm pulling in another question, Dr. Alopa. This is from Mr. Sharma. He says, hello, Dr. Alopa. I'm from Pondicherry. After injury or surgery, can't the muscles gain strength back naturally over a period of time? So he's questioning whether the same effect would come without physiotherapy.
I would say that physiotherapy definitely enhances and accelerates the speed of recovery. There are grades of muscle weakness. So probably a grade one muscle weakness, which is not very bad, might
Right.
gain the strength back if we have not done anything actively. But a grade
Okay.
two and grade three muscle weakness, if we don't intervene with physiotherapy exercises, they
Right.
might stay weak for a prolonged period of time. This indirectly affects the lifestyle and the basic characteristic of a dog, which is being playful. So if a dog is not playful or if a dog is not mischievous, probably you are taking away something from him. So to make sure that the dog is going back to his playful self, you should see to it that you are giving him physio exercises which will accelerate the strengthening of muscles.
Absolutely. So true. Very nice. This thing about bringing the dog back into its natural, playful, character.
Happy
As soon
dog.
as
They should be happy dogs.
yeah, we must have the happy dog. That's what we want. We only want happy dogs around us. Okay, let's move
Right.
on. Let's move on to this topic of most common health issues encountered. Now, it would be a sort of a repetition because you've said that hip dysplasia and these problems are
Yes.
commonly encountered. But I am now looking at this question purely from the pet parent point of view. So
Right.
before we
So
go,
when a pet
go
parent,
into this,
yeah.
before we go into this, sorry to interrupt you, Doctor. before we go into this, I would like to ask you, how easy is it for a pet parent to understand physiotherapy? How much, because you are the only one who's available to us. You are in Pune, and there are pet parents all over the country in large numbers who are facing this problem. How do they learn to do it themselves?
Uh, they can give me a call. I will definitely make them. I will definitely make them understand. See, for any physiotherapist, what is a key important point is to spend time with the patient and the client. You cannot expect a pet parent to be convinced for physiotherapy if you spend like 5 minutes. You have to spend around 30 to 45 minutes to show them, to probably, you can convince them by showing your previous work, what one case was and what it, what we achieved by physiotherapy. Communication is definitely important. And once they get the catch, or once they get the hold of physiotherapy, I am sure that, even if what usually I practice over here, even in Pune, is like I have usually weekly one session, a supervised session with the patient. And then I give a set of exercises for them to follow at home. And touchwood, 90% of my clients have followed them.
Okay. Would you like to share some of the pictures of your treatment with some of the dogs that you've treated in the recent past? You told me you had some pictures.
Yeah, sure. I do have. Yes. Just give me a
Would
minute.
like to see how it's done.
Yeah.
And if you can also explain, when the picture pops up, what exactly was the problem with that particular pet? Okay, we have a golden retriever. What is it?
All right.
What is it? A lab?
So yes, we have a golden retriever. She had undergone. She was a 2-year-old young dog. She had undergone a hip dysplasia surgery.
Okay.
And so after a surgery, obviously what a surgeon does is he sutures. So many a times what happens is these sutures, or the scar which is formed, it gets adhered down to the muscle layer, and it affects the muscle play or the muscle mobility.
Right.
So right now over here, what I'm doing is a technique called a scar mobilization. So you just have to mobilize the scar. You just have to move the scar in the perpendicular direction of the scar. So if the scar is vertical, you have to move the scar horizontally. And that is what I'm doing over here. Her name is Cherry. She's a very cute golden retriever that I've treated.
Okay, so basically, as you called it, scar mobilization.
Scar mobilization, yes, that is very important. Here, what I'm doing in the second picture is the passive movement. So this was a crossbreeded dog, and he had, because of disc bulges in his spine, he had landed up in paraplegia, that is the hind limb paralysis. Okay. And as I told you, what I mentioned earlier, the phase 1 physio, where we do the passive movements. Right. So this is how you get them done. Like the dog is lying down, and I'm just moving his ankle. So I have got a firm grip on his leg. I have got a firm grip on his paw, and I'm just moving the ankle throughout the complete range of movement.
Oh, okay. That's very interesting. And what was the age of this dog, you said?
This dog was, I suppose, 3 years, 3 or 4 years when he had this hind limb paralysis. So this is again the same dog. So it was like his hind limbs were not bearing weight at all. He was not able to sit properly on his hind limbs. And here I'm making a use of a gym ball or a vesicular ball, where I can gradually make his hind limbs bear weight and train his muscles for hind limb strengthening and hind limb weight bearing. So this is the same.
And what percentage of success would you give yourself in such a case?
I would say, it basically differs from how bad the paralysis is or how bad the compression of the spinal cord is. I have seen patients where they had to be operated because like, the compression was really bad, and we were not getting any results with physio. But I have also seen patients who are doing extremely well with physiotherapy in spite of having spinal cord compressions. So from the patients of paraplegia that I have treated, I would say that at least 80% of my patients are up and running right now.
Oh, wonderful. That's huge success.
Yeah.
80% is like Very, very high rate of success.
Yes,
So
yes.
your patients are blessed to have you, Dr. Alopa. 80% is huge. I'm pulling in at this stage, I'm pulling in another question by Mr. Mittal. He says, is physiotherapy a complete medical solution for a disease? Which are the diseases which can be independently treated by physio?
So any kind of musculoskeletal diseases which are in their grade 1 and grade 2 can definitely be treated by physiotherapy.
Right.
So I have met many veterinary surgeons who also say that if the hip dysplasia is of grade 1, is like there is only a minimal malformation of the hip joint socket, they still advise for physiotherapy and the conservative method of treatment rather than opening up and rather than doing a surgery. So any kind of musculoskeletal problem which is in grade 1 and grade 2 can be definitely treated with physio. We also have to respect the limits that yes, in grade 3 types of conditions, we definitely need to go for surgeries.
Okay. We had a question which was sent to us yesterday, Dr. Lopa. This was a question. He said, I have a golden retriever puppy. He's 3 months, 10 days old. His hind legs are
Mhm.
curving gradually. Please tell me the remedy.
Okay. Okay, so this kind of a case will need a detailed evaluation, a clinical evaluation. The bowing of the hind limbs is attributed to many factors. Some can be genetic, some can be nutritional deficiencies. There might be some trauma in the puppyhood which was overlooked or which was not taken care of. So for this, he definitely needs to visit a veterinary doctor as soon as possible and get a thorough clinical evaluation done. We definitely need the x-rays and probably a little bit of blood profile also to see if there are any nutritional deficiencies. And once that is clear, we can make a protocol for of physiotherapy for his dog.
Okay, I have a question from personal experience on this. We've talked about
Mm-hmm.
so much this. I've had Labradors and Golden Retrievers and Irish Setters and Cocker Spaniels, and all these dogs have wonderfully active tails. They are happy, they are wagging, they are extremely active tails. And there have been instances where there is an injury to a tail. It might not just be, trapped in the door or trapped in the car door, and it's just injury because it's dragging it vigorously and it hits something hard. Have you come across any
Right.
cases of physio being involved in such an injury?
No, not really, not till now. But what I
Okay.
can think of is if there is a small injury like trapping in the door or trapping in the car door, the first
Right.
thing that any pet parent should do is apply lots and lots of ice.
Okay. Yes.
Yeah,
So
because that
to
takes
prevent
care
it
of
well.
the inflammation that has happened to the tail, and
Right.
it will help in faster recovery. So usually, what I would suggest in this case is icing for 3 times in a day for at least a period of 2 weeks.
Right.
Yeah.
Okay. Another interesting one we are pulling up. Deepak says, what exercises can be done to overcome the problem caused by tiles and slippery flooring?
So what you see, you cannot really help. These are slippery floorings. What I usually suggest my patients is either you wear anti-skid shoes, especially when you are making your dog play and run in your home with slippery tiles. What I usually also suggest is whatever are the energy consuming exercises, they should be done outdoor because slippery
Okay.
tiles just aggravate the issues. They can also create issues like cruciate ligament tears. So it
Okay.
is always better to prevent than to later on go into complications. So whatever are the energy consuming exercises or plays that should be done outside the home, probably in a ground, in your society parking, because in society parking usually there are anti-skid tiles. And if that is not possible, as in for example if you want to play a tug game with your dog, a tug of war, so probably what you can do is you can put a yoga mat and then you can make the dog play on it. Because
So
nowadays, most of us have yoga mats at home.
yeah, basically the dog needs traction. It doesn't need the floor slipping under its feet. So that will strengthen its
Yes,
muscles
it
and
has to get a good grip. That has to get. I mean, the dog has to get a good grip. For
absolutely.
one more exercise to enhance the gripping of the dog is you can just tickle in between the paw pads,
Oh,
hold
okay.
the ankle. hold the ankle so that because if you tickle the paw pad, the dog withdraws his limb. So just hold the ankle, don't allow the dog to withdraw the limb, but just keep on tickling. You will see minimal muscle contraction like this. You can observe it right away. You can see a minimal muscle contraction like this, and which will take care of the gripping muscles.
Wow, I didn't know that. Thank you. That's, you keep learning. So I learned something new today. Okay, there's another one. How is the response of veterinary doctors to canine physiotherapy? This is from your field, and we should know how the doctors are responding.
I would say that the awareness is definitely increasing. Because most of us have visited a human physiotherapist, or have at least heard about human physiotherapy and the positive benefits that the physiotherapy is giving. So I would definitely say that veterinary doctors are becoming open for referring physiotherapy, and I would say that it is increasing. I won't say that it is, it has reached its peak, and it is, everyone is already aware of canine physiotherapy, but yes, it is increasing.
Okay.
I have come across veterinary doctors who are, who respect physiotherapy a lot. One of such doctors, I have already mentioned Dr. Milind Hatekar's name, but another one is Dr. Anirudh Ajjampur from Bangalore. So whenever he comes across a case like this, he just gives me a call and asks me that, what can we do in physiotherapy? So yes, definitely it is. I think it's a bright future for canine physiotherapy if awareness is done in the right way.
There is, and I'm using this forum as a wake-up call for the veterinary doctors all over the country. Ladies and gentlemen, we have this facility, and this can, totally change the manner in which we treat our dogs post-operative recuperation time. So I think we should all use this. Okay, I'm pulling in another question from Anjali Vaid. She wants to know, do you use water therapy a lot? How much does it help? I have seen treadmills in water for exercise and physiotherapy.
Yes, water therapy helps a lot, but usually what I tell my patients is like, pet parents have this notion in their mind that physiotherapy in dogs means, chalo, push the dog in the swimming pool, let him swim, and that's done. So it is definitely not like that. We have a plethora of exercises which we can do in water, because water gives you a benefit of buoyancy. You can make the muscles work without stressing them a lot, right? Because the muscles are helped by water buoyancy. So we have a lot of exercises. So even in the pool that I usually take my hydrotherapy sessions in, we have made like 2 steps, big steps in that pool. So whatever are the exercises, I can make the dog stand on the step and I can get the exercises done. And once he's ready for swimming, only then he takes a plunge into the water for swimming.
Okay, and do you find that dogs are, naturally responsive and naturally keen to go for a swim?
Differs from breed to breed, because I have seen 2 cocker spaniels hating water. My own dog hates water, so he doesn't like to swim.
The labs and golden retrievers just jump in.
Yes, they just want to anywhere they see water and they just want to plunge in. They don't bother whether it is an actual swimming pool or a puddle. They just want to plunge in.
Yeah, I'm not sure I understand this, Mr. Rakesh. If you can, elaborate. Hello, Dr. Alopa. What do you suggest for pain in pet? I don't know. Are you looking for a medicine? We wouldn't be giving any prescriptions, but if you want to elaborate your question, please ask again, because I'm not sure of what you want to know.
I think probably what he means is like the first symptoms of pain. If I am not mistaken, I don't know. Probably like when the dog just starts limping, or just the lameness when just the lameness is about to set in. Probably of that sort. I'm not sure.
Okay. Anyway, we would be happy if he asks or supplements his question. We are going back to the most common health issues encountered, because we are already into 50 minutes. Tell me something about injuries that you have come to know about: jumping off the bed, or climbing too many stairs, or getting into a car, getting out of a car. all those kind of
Cruciate ligament injuries, that is the knee injuries, most common in this. Because what happens is, they tend to, dogs being their playful self, they will tend to jump here and there. And even a small wrong landing on a slippery floor will tend to give them a cruciate ligament injury, that is a knee injury. So cruciate ligament usually gives stability to the knee joint by connecting the femur, that is the thigh bone, and the tibia, that is the leg bone. So if the cruciate ligaments are injured or are torn, so we have broad basic two classification is like the partially torn and the fully torn, completely torn. So if it is completely torn, then the tibia is moving freely without any constraint. The stability is hampered. The lameness sets in. There is muscle weakness because there is pain. So I have seen with this kind of history where like the dog has jumped in a wrong way or jumped from a car in a wrong way. Mostly I have seen the cruciate ligament injuries.
Yes, I'd like to share my personal experience in this, Dr. Alopa. I have some Pomeranians, and I have a 2.5-year-old lovely little Pomeranian bitch. I was absolutely fine and sitting with my wife on the sofa and decided to jump off. And when she landed, in Pomeranians, we have this, the patella pops out.
Yes.
Yeah. So now you have a dog that's got a limb that is shortened because the patella is out of place. And you either use it, the only cure is either you push it back into place or you do a surgery. Now, the POM being what it is, small and very little body weight and extremely delicate, we were not sure of whether we would like to put her through surgery. And our veterinary doctor in Gurgaon where I live, he recommended, he put it back in, put a tape and said that, let it rest and then start giving this massage and this physiotherapy. Like you suggested, when the dog is sitting, you can do the massage and rotate. And it's been over a year and a half now, and we did not do any surgery. She's fine. We've restricted her climbing on stairs, but otherwise she's doing fine. So, from my personal experience on the phone, I have seen that physiotherapy helps.
Yes, it definitely helps. I would say that there are many conditions that we can treat conservatively rather than going for surgery. But where surgery is needed, it is needed. There are no two ways about it.
Okay. And anything about
also like in toy breeds or in small breeds, this patella popping is very common.
Very common. Yes, I know. In Pomeranians, they're prone to it. But tell me something, herniated discs. Any cases that you've come across?
Oh yes, I had treated a beagle recently, very recently. They used to come, the persistence and the sincerity of the pet parents was such that they used to come all the way from Lonavala to Pune only for physio session.
Wow.
Only for physio session. And he is doing wonderful. He is jumping around, he's running around, he's having his usual walks. He's a young beagle of 3 years. So he's absolutely fine now. And even like whatever I used to ask them to, get the exercises done from their dog, they used to do it very religiously, which is a very important part in rehabilitation. That if the pet parents are not religious and sincere enough, then of course there won't be any results. But if they are, then the results are magical.
Right. It's wonderful to know, that there is a pet parent who's caring, who believes in a new treatment, a new regime that is coming in. And then with that kind of success, you're saying it's just a wonderful story. So again, I'm repeating that this is the forum that, we were hoping that you would bring out the new aspects of physiotherapy that are coming in the canine world. And we were hoping at DogSpot that this is a new topic, and I'm sure this is not the 1 hour is not sufficient to cover it. So, we are looking forward to more questions. We are looking forward to great detail, like you said, for working dogs separately, herding dogs separately. And I think that, we should schedule more of these sessions now in the coming few days and invite people to send in particular cases. If our pet parents have pictures or videos or particular x-rays to show and share, then we at DogSpot, and I'm sure Dr. Alopa would take out some time from her schedule, and we would be happy to address those, because we are deeply concerned about this area, and we want, as Dr. Alopa said, we want happy dogs back. So, I'd like to give you a little time, Dr. Alopa, to wind up and say something if you want, because we are running into the last 5 minutes of our session. So
Yeah. What I would be suggesting or recommending the pet parents is definitely make your dogs exercise. I mean, definitely exercise your dogs. Don't keep them lethargic. See to it that, as I told you, when you're having a rough play, see to it that it is not done on slippery surfaces. Make sure that yoga mats are handy, where you can just place a yoga mat and have a tug of war game with your dog. I would definitely suggest that don't ignore the symptoms. Even the slightest of a symptom ignored is a big complication later on. So the moment the symptom sets in or you are observing it, please seek help. Please go to your veterinary doctor. You are a pet parent, so don't hesitate to invest in the health of your pet.
Absolutely.
That is what I would definitely invest. By investing, I'm not just meaning the monetary meaning. I'm also, pointing out and investing the time to be the pet parent.
Right. Absolutely.
Yeah.
So let me thank you, Dr. Alopa, for an absolute eye-opener. It's a new area. We are pioneering this with your help and under your guidance and leadership, and we hope to make this, the most sought-after field of medicine now in canine world in India. So let's keep informing our pet parents regularly. And I would like to thank.
Yes, and I would like to thank DogSpot because for having me over here, so that I was able to interact with so many people in just 1 hour. Otherwise, it would have been impossible.
It's our privilege and pleasure.
And
we would like to thank all our viewers.
Thank you so much for hosting me.
No, my pleasure, and thank you to back-end team at DogSpot. Thank you, Dr. Alopa. We hope to be in touch with you soon again.
Definitely. Thank you so much.
Thank you. Have a good evening, and bye-bye, viewers. We should be back tomorrow.
Yeah, bye-bye.
Bye-bye.